News.
That breaking news from St. Joseph tonight, as we have just confirmed an employee at the Triumph Foods processing plant has died of complications from COVID-19. The employee, a man in his 40s whose name is not being released, had underlying health conditions according to the company. The employee was one of the first to be tested and had not been to work since April 21st. In a statement, the company says it's implementing all measures to ensure the health and safety of its employees. For local hospitals, it is a step closer to what things were like before COVID-19. The virus remains a concern, but now hospitals have adequate supplies and are adding more safety methods so they can resume non-emergency procedures. KMBC 9's Brian Johnson live tonight with the changes at the University of Kansas Health System. Brian?
Yeah, Chris, a big part of this is protective gear. Hospitals now have adequate supplies. They're also changing the way they screen patients, taking their temperatures when they come in, as well as more precautions once they get inside the hospital. For nearly 2 months, there have been no elective procedures. Many people were afraid and nervous to go to the emergency room.
We've heard that heart attack rates are up. Heart failure issues are a problem.
It's why hospitals like the University of Kansas Health System are glad they could reopen. 3,400 people had to delay their surgeries.
It's about taking care of the patient. You know, we haven't been able to do that in full capacity, and there are people out there that are suffering.
Reopening will look different. Visitor restrictions and social distancing remain, but operating room capacity will be less, and patients will be pre-screened for COVID-19 48 hours before surgery.
I wouldn't say it's full. We live in a different world now.
The hospital may increase hours and add surgeries Saturdays so they can get to everyone quickly. HCA Midwest is reopening as well.
People still get sick. People still need to take care of their blood pressure and their diabetes, and we still need to manage people's health.
Dr. Rachel Haley works at Lee Summit Medical Center.
It includes temperature checking, masking of patients, limiting the amount of people that can come up.
Hospitals say they are safer than ever before, so people don't have to worry to get the treatments they need.
We need to take care of people. That's the thing. Health care can't stop. People still need to take care of themselves.
Brian Johnson, KMBC 9 News.
Children's Mercy is also getting ready to resume elective procedures with clinic visits beginning May 18th. 2 of its ERs and 3 urgent care facilities remained open. As for new positive cases in the Kansas City area, 35 more cases were added today, down from almost 200 yesterday. 186 new cases are being reported statewide in Missouri, pushing the state total to over 9,100. Kansas counts 276 new cases today, pushing that state's total to over 5,700 since the pandemic began. Jackson County is releasing its plan to reopen businesses beginning Monday. Restaurants, stores, and salons may open for business in Jackson County outside of Kansas City, Missouri, with social distancing. Businesses smaller than 10,000 square feet must limit occupancy to 25%. Bigger than 10,000 square feet, occupancy will be capped at 10%. Large gatherings are still being restricted to 10 or fewer people. Gyms and entertainment venues remain closed. Some businesses in Kansas City, Missouri reopened today under the mayor's 10-10-10 plan. Only 10% of a building's capacity or 10 people will be allowed inside, whichever is greater. Right now, places with little traffic like salons and barber shops are open with restrictions. Haircuts have been on the minds of a lot of people through this pandemic. Laura Moritz is back tonight after seeing how a Northland salon, Laura, really got creative today cutting hair.
Yes, they did. Salon Inspire at North Oak and 152 obeyed the 10-10-10 rule by moving part of the hair cutting operation outside.
And goatee, do you want that trimmed down too?
Yes, please. I would say my last haircut probably was in beginning of February, roughly.
It's been a long wait to get trimmed up, cleaned up, and just feeling better.
We knew it wouldn't last forever also, so we just waited and we were given the green light today to open with some limited numbers, and we're just, thrilled. We're thrilled to be open.
Open for business in the open air of the parking lot. Salon Inspire could barely get these tents up before a line formed.
We weren't done setting up until about 12:40, and there was already a line at 12:40. So we had about 8 people here at 12:40. We got through the first round and we had about 6 or 8 more people waiting. So we've been going strong most of the day.
Inside the salon, it's business unusual. Typically, there's 17 chairs and 17 stylists working at one time.
There's usually about 25 or 30 people in the salon at a time, so having 10 is quite reduced.
From shaggy to shorn, it doesn't matter whether it's inside or out. It's time to get cleaned up after a long pandemic-induced wait.
In 5 hours, those stylists had finished 45 haircuts, and that's just outside. Salon Inspire thinks they'll do it again on Saturday. Just go to their website to see when. Chris?
All right,
I'm
Laura.
starting to feel like I need one too.
Boy, it was quite a scene out there at 152 in North Oak, that's for sure. Well, in Westport, there is an idea to reopen businesses there, calling for shutting down Westport Road in Pennsylvania, allowing restaurants to use that space for open-air dining. The plan comes from the Westport Regional Business League. The owner of Chicken and Waffle says business has been painfully slow with only takeout and delivery orders. He says he's open to the idea of closing streets to attract more customers.
Anything that will be able to do a 6-foot distance and then still draw people back to Westport. You know, we're known for our patios anyway, so it's just a larger patio, so I'm all for it.
This is the sort of idea that I think I'm excited about. What I want to make sure we're doing is doing it right, doing it in a staggered perspective, doing it incrementally.
Mayor Lucas says the move will likely require some city council action. He plans to begin talking about that soon. Kansas City, Missouri's health director says it's too soon to ease restrictions. Dr. Rex Archer worries it'll give people a false sense of security. He expects the number of cases and deaths to go up as more people go out in public. He says people with no symptoms could continue to infect the vulnerable, and he adds the city isn't where it needs to be when it comes to testing or contact tracing.
We still have $0 federal dollars from COVID-19 coming down to us to be able to hire staff or to be able to pay for more testing. We haven't gotten anything yet, and now we're opening back up before we get any resources to deal with this.
Dr. Archer urges people to continue to stay home as much as possible and to wear a mask in public. To see how states, counties, and cities are reopening, check out our list at KMBC.com.